So we did mention the figure of $420 million of charity care. I want you to know that's 250,000 people that we were able to make their health care better, despite the fact that they didn't have the money to pay for us. We have 4 community clinics that we run, charity clinics that we run, and we support another 48 others economically, as well as with personnel and supplies. Another way of improving access is by building buildings. And this also does contribute to the economic vibrancy of the communities that we live in. So in the last 5 years, we've had 41 major construction projects. We define major project as more than $5 million. Mary Carol, please don't ever think about a major project at our house, okay? We would be in big trouble, I think. But this is real activity that provides different kinds of access to people, again, regardless of their ability to pay. And over the next year, we have another $1.75 billion planned that we will invest in our communities to make sure that people have the right kind of facilities to meet their healthcare needs. One of my favorite projects recently is this van that you see. It's actually a bus, and it has 2 exam rooms in it. It's going to go into action in May 2017. It'll be staffed by a primary care doctor and an advanced practice clinician. And they will be active in Garfield and Piute counties, which, as many of you know, are very sparsely populated. And they're going to meet the patients where they live, how they want to be met, when they want to be met. This is an investment that we're pleased to make, and I think it really speaks to the future of the consumerism that's rampant in healthcare. We know that in a high deductible environment, people are very price sensitive, as they should be. And particularly for the millennials, they're very thoughtful about how and when they want to be seen. We've begun to develop a robust telehealth presence. Connect Care has provided about 4,500 visits up through the end of 2016. It's growing month by month. And you can see how a telehealth visit is about 1/10 of the cost of an emergency department visit. So we work hard to get people into the right level of care so they don't bear undue burden, and nor does the system. We also bring telehealth to specialists. We bring quality care closer to home, whether it's critical care, telestroke, crisis psychiatric care, newborn care, pediatric ICU, or antibiotic stewardship. We are able to support an entire system and actually beyond, using a little bit of technology and a lot of collaboration to the benefit of a population's health. This stacks up to about 250,000 consults to date and growing quickly year by year. This is the future, and it's not impersonal because people, when you talk to them, they get the warmth across the lines, but they're really grateful because they have the power to choose how they're getting interacted with. Again, this is what people want in this era, and we believe we want to see them where, when, and how they wish to be seen. We also do telehealth outreach outside of Intermountain healthcare. So we're in Montana, Wyoming, Idaho, Nevada, and Utah, and these are non-Intermountain facilities. Now, many systems, when they do outreach, their goal is to extract patients in the form of transports back into their own system to the economic benefit of that system, often to the detriment of families who need to travel. We actually take the same approach with these other facilities as we do with our own hospitals, and that's it. Let's keep people as close to home as we possibly can. What I can tell you is that we're going to be publishing some extraordinary results in the next couple of months that speak to a dramatic reduction in mortality for telecritical care that's provided outside of our system to patients who are in some of these smaller hospitals. This is good stuff. This is collaboration that goes beyond the walls of our own system. Now, if you do need to travel, we've actually moved about 65,000 patients to the tune of 10 million air miles over the history of life flight. And currently we have 7 helicopters, 2 turboprops, and a jet at our disposal to get people where they need to go regardless of conditions.